women who have endometriosis, there's tissue that is the same as the lining of the womb, which is the endometrium, elsewhere in the body. So every tissue, every organ has characteristic cells, tissues that make up that organ, and they respond to different circumstances, so different hormones, different conditions. The cells are all very specific. So the lining of the womb, the endometrium, the tissue like that can be elsewhere in the body with people who have endometriosis. Now, we don't know quite how common endometriosis is because for so many women, it can take years for a diagnosis. So it's probably more common than we realise. Now, it can be very difficult to diagnose endometriosis because the gold standard, if you like, would be looking inside everybody and seeing if you can see these endometriosis deposits throughout the body. Now, it's not very easy, is it, to open people up all the time? And lots of people get period pains, they get bloating, they get discomfort, and it wouldn't be practical to look inside everyone's abdomen. Some people do scans. So the scanning, ultrasound scans are getting more and more sensitive, and some people can have a diagnosis by scan, but a normal scan doesn't mean the person doesn't have endometriosis. There isn't a blood test that we can do to determine it. So it's often from careful history taking, seeing how symptoms change throughout the month, and sometimes a diagnostic test as well. But there are a lot of women who, when you go to different forums and read, are just not being believed at all. The pain that they're getting, sometimes associated with nausea, vomiting, feeling quite unwell, is often dismissed, especially if they've had normal scans. And we know that a lot of women aren't listened to during menopause or perimenopause, but a lot of women, the stories of women with endometriosis are awful, actually. The most important thing for me as a doctor is to listen to patients, understand what's going on, and really help them to try and make a diagnosis and a treatment plan that's right for them.